Hello and welcome to Everyday Medicine. I'm Dr. Luke and I'd like to thank you for joining me on this podcast series where we share conversations with colleagues exploring their special interests in medicine and bringing insights, ideas and advice which I hope will be applicable for our medical practices. In this podcast episode, we're talking with an expert, Dr. Robert Kaplan, on pandemics, a repeating history. Before starting, for Australian audiences, listening does give you eligibility for your CPD, so log in and add this as an activity. And you may also consider journaling, reflection and adding to the review and performance section in your CPD. Well, a pandemic is defined as a new disease or new strain of an existing disease spreading worldwide. An outbreak refers to a localised epidemic, something that affects hundreds, sometimes thousands. An epidemic refers to an illness or infection that is in excess of normal, and pandemic is an epidemic that occurs over a very wide area, crosses international boundaries, and touches thousands or millions. The enormous health and financial impacts of epidemics and pandemics are made worse through human foibles like fear, denial, panic, complacency, hubris, and self-interest. Experts advise we can end epidemics by facing up to them and by applying concrete actions, ensuring building resilient health systems and fortifying 3 lines of defence against disease, including prevention, detection and response, and ensuring timely and accurate communication, investing in smart innovation and spending wisely to prevent disease before an epidemic strikes. Well, pandemics have far-reaching effects, as we have recently witnessed with COVID-19, and I was curious to reflect on the way we respond to this threat as a community from the psychological perspective. Humans have had to respond to many pandemics over the course of recorded history, notably the so-called Black Plagues or Black Death, spread by rats carrying Yersinia pestis-infected fleas hidden within their pelt. And a series of Black Death pandemics dramatically and profoundly affected European and Middle Eastern populations, both in the 6th to 8th century plague of Justinian and 14th to 19th century, killing up to half the local population, that's over 100 million people, but paradoxically bringing about cultural and economic renewal. Before this was a deadly smallpox pandemic called the Antonine Plague during the time of Marcus Aurelius, around 160 to 180 AD, killing an estimated 25 to 30% of the Roman population, and no doubt far more through Eurasia, perhaps between 5 and 20 million dead. In the 16th century, between 1545 and 1548, the so-called Cocalitzli epidemic in Mexico and Central America, caused by an unidentified pathogen, reportedly killed 5 to 15 million. Fast forward to 1918, the Spanish flu, caused by influenza H1N1, with between 17 and 100 million dead. The HIV epidemic, responsible for approximately 44 million deaths, with fortunately treatments now available, and not forgetting bird flu and swine flu, our most recent pandemic experience with COVID-19 claiming between 7 and 36 million lives. But when I came across Dr. Robert Kaplan's excellent article in the May edition of the Gut Republic discussing pandemics and the often flawed human response where fear, emotion and disinformation easily created perspective, I was keen to invite him to talk on this subject on Everyday Medicine. Rob is a forensic psychiatrist and clinical associate professor at Western Sydney University, as well as a keen historian and author with a sharp wit and eye for the arcane. His latest book is The King Who Strangled His Psychiatrist and Other Dark Tales. But he also has a deep catalogue of publishing, including the books Medical Murder, Disturbing Tales of Doctors Who Kill, and The Exceptional Brain and How It Changed the World, amongst others. He's a sought-after speaker and key thinker in forensic psychiatry and serves on the Professional Advisory Panel Victim Services. Please welcome Rob to the podcast. So, Dr. Rob Kaplan, forensic psychiatrist, welcome to Everyday Medicine. Rob, thank you for joining me.
Thanks, Luke. It's been a pleasure to be here.
Well, I'm very excited about this conversation. Thank you for letting me pursue you and for being so open to my overtures to come on as a guest. I read about your books and your prolific authorship in The Gut Republic and History of Pandemics is Repeating Itself. And that's from your book, King Who Strangled His Psychiatrist and Other Dark Tales. And I thought that sounds very interesting. This guy's interesting. So, I love the article and I thought I should have a talk with you about pandemics, given that we've been through such a terrible time in the world recently. And Rob, before we sort of start talking about, your authorship and that story about pandemics, I'd love to just get a little bit of a backstory, your journey, Rob, into psychiatry from your beginnings. Tell me why. Just take me through it, Rob.
No, that's very easy. Look, I trained in medicine at the University of Cape Town in South Africa, where I grew up. After a couple of years of wandering around, I arrived in Sydney, opened the paper and saw wanted pathology registrar. So I did autopsies for and all the stuff that goes with it for 20 months at Royal North Shore Hospital, and then decided that I wasn't pathology material. And I trained in psychiatry at Prince of Wales, Prince Henry, all that sort of stuff. And yeah, I've had a career in general psychiatry, but my speciality initially was in liaison psychiatry. So I did a lot of things with pain, general hospital patients,
Yeah.
sleep and that. And then after running a practice for quite a few years, I've switched to forensic psychiatry, and the rest is history.
Tell us a bit about forensic psychiatry, because I think perhaps a lot of us haven't appreciated all the various aspects of psychiatry. We probably have a slightly jaundiced view of psychiatry from our time in psychiatric wards in public hospitals when we were trainees. But as you've just pointed out, there's lots and lots of different aspects to this fascinating journey into the human mind. What is forensic psychiatry? Just update us on that.
It's any psychiatry dealing with the law. So you can divide it very broadly into two areas. The one is criminal law, and that in itself is you assess people who are going to court, whether they are eligible to, whether they can actually be tried, or what their state of mind is, or pre-sentence reports. But it also involves looking after prisoners.
Mm.
The other half, which is what I largely do now, is you can call it medico-legal psychiatry. And this is to do with any kind of claim, insurance, injury, personal liability, medical negligence, and the whole range wherever legal things come in. I don't go to work in the prisons now, but I do see some criminal cases still, because I call them walk-ins, or these are people out on bail, pre-sentence reports, relatively minor crimes. So yeah, that's the extent of my work now.
It's interesting, because they talk about, the criminally insane. I remember when I was training, there was a psychiatrist who used to say about children that they were either mad, bad, or sad. But I guess people that are involved with the judiciary and with criminal cases, we have to assume that most of them have got a rather nasty streak somewhere along the line. There's some sort of sociopathy there. Your assessment would be, in some senses, teasing out whether they are just acting to some degree to avoid a sentence, or whether they really truly have a major psychiatric condition, I'm guessing. That would be quite difficult. See, you have to tease a lot apart, don't you, there, to get into their head.
You do. And I always say when I'm teaching registrars that if you want to do forensic psychiatry, you have to have the highest level of skills of
Yeah.
psychiatric assessment. It's not just saying, well, they're depressed or they're
Yes.
anxious. But the biggest question in forensic psychiatry is nature versus nurture. Are psychopaths the ultimate kind of criminal, born that way, or is it the environment? When you start off in forensics, it's, oh, they've all had terrible backgrounds and they had this happen to them and that. And then when you talk to the grizzled old, people that you go to for advice, they all say, you will change and you'll realize a lot of these people, it doesn't matter what circumstances, they were born that way. And I think that, frivolity aside, the current view is that people are born psychopathic, but their circumstances, when they're growing up, tend to bring it out.
Influences. I read a book that I'm not sure if you're aware of this, as a Welsh author, The Psychopath Test, which I really enjoyed. But he suggests about 1%. That was his figure. About 1% of people are psychopaths. Which doesn't mean, or sociopathic, which doesn't mean that they're going to be serial killers, of course, but they may end up as, as our political elite or as in military organisations or in banking, whatever, finance. And I wondered on that, if that is actually a true statistic, whether our society biologically sort of needs that person who's a bit narcissistic, a bit sociopathic, that thinking about how we might have been 20 or 30,000 years ago. Did community groups need that kind of person who was reasonably fearless, would be able to go and engage in warfare with other groups, to protect, to some degree, a band that they maybe felt loosely associated with? I don't know. There must be some biological function for this person to
There's
control.
an evolutionary function to aggression, to leadership, the
Yes,
so-called alpha male. And
yes,
this is a very interesting thing with another thing I'm writing about called hybristophilia. Now, that's a fabulous Greek word. Nobody knows what the hell it means, but hybristophilia occurs almost entirely in women who are attracted to people who do terrible things.
yes.
And, the classic story is these people who write to Charles Manson and ask to get married.
Yes,
And then occasionally you get the Bonnie and Clydes, where a woman joins an
yes,
active criminal. And the evolutionary theory is that these are the top guys. In evolutionary terms, hook up with them because they will protect you and look after you. As I said, it's all theory, but that's pretty much what it is. The problem we have in psychiatry is that these definitions of personality, narcissistic personality, psychopathic personality, they are very, very weak. And there's huge flexibility when people just slap those labels on. So, in fact, it's the loosest category in psychiatry. And there's also, of course, we now in what I call the postmodern world. And what is the postmodern world? Well, you go on the internet and you read about all these things, and suddenly everybody you deal with is a narcissist, a
yes,
psychopath,
yes.
or the current favorite, a borderline personality.
Well, it's a slur, isn't it? And it's easy, as you say, to throw these loose definitions around to attack people and criticise their character. I'm intrigued, Rob, to take you from what you were doing in SLR in forensic psychiatry to your prolific authorship. Rob, how did you make that leap into writing? You're obviously a very capable writer. It's a difficult field to excel in, isn't it? But you were doing that. How did you make that leap?
I think I was always keen on writing, but when I ran a sort of what you'd call a general psychiatric practice, and I think you'll know this yourself, I was just too busy.
Yeah.
Now, once I changed to forensic, it's like rheumatology. Thing, I don't know, it was like an unborn fetus that was just waiting to pop out, and it pushed me along. So, yeah, I like to think that I'm as much of a historian as I am a forensic writer.
But you have to have an interest and a curious mind, which obviously you do, because when we start talking about pandemics, there's a lot of information you have to dig up historically. Take us a little bit through the history of pandemics that you've written about. Would you
Yeah.
fill us in on some of the key things that we should know?
Well, let me take you back. You say, how do I get onto these things? About 20 years ago, more than 20 years ago, through a friend of a friend of a friend, a South African historian, contacted me, and he was writing about a murderous psychopath, sex slaver, and God knows what this guy was. He was born in 1865, went around to South Africa, to uh, all around South America. And he said, look, I need some advice. I can't find a psychiatrist. And this guy, he said, I want you to, is he a psychopath? And he's got syphilis.
Oh, I see. Yes.
So I did all sorts of things about it. And it's a whole subject on its own to talk about this guy. But it got me interested in syphilis. The origins of syphilis, it's the oldest argument in medical history, going back to 1494. So I started thinking, wow, this is interesting. So I learned all about syphilis right through the time that it started with when Columbus
Mm.
returned.
Yes.
And then, well, this is going to shock you. I got asked to write something about Hitler. And I was doing research into Hitler. This is the medical side of Hitler, of course. And I found what you can call a sort of a school of thought amongst a bunch of neurologists, historians, who said that Hitler had something called encephalitis lethargica. This is the sleeping sickness.
Yes.
And I'll come up to that when we talk about pandemics. So, of course, I had to learn about encephalitis lethargica, and that was really fascinating. So once I got onto that, it just opened the whole pandemic box.
Yeah, was there an argument that I think you were saying, I think you've written that Hitler had this idea that syphilis was spread by Jews and they were all infected with syphilis, congenitally or otherwise. Is that right? Well, I mean, did Hitler have syphilis, do we think, as well?
Couple of questions in that statement. Look,
there's a lot of.
I think
Napoleon did, didn't he? I'm pretty sure.
No. Whenever I used to give a talk on the history of syphilis,
right,
people shoot up afterwards and find whoever they hate.
Right.
When I was doing it in South Africa, does Nelson Mandela have it? Does Robert Mugabe have it?
Right. Yes.
And everybody else, Hitler, Stalin, Lenin. Now, let me get a couple of things right. No, Hitler didn't have syphilis, and he was tested for that. Stalin didn't have syphilis, but what's come out more recently is that Lenin died of syphilis. So he genuinely did have it, and it was covered up by the Russians.
Right.
No evidence Napoleon had it, I'm afraid. It's a good idea, but we'll leave him alone.
Right. Okay.
Now, to go to the second part, one of the reasons the history of syphilis is so interesting is that as an illness, it sort of inserts itself into the culture. Syphilis is the ultimate kind of bad thing. And then once it started, people used it as a psychological weapon. Syphilis was called the English disease. Why? Because the English are the enemy, so they carry it. The French disease, the Polish disease. I think there are 14 countries that have told it's your disease. So firstly, syphilis had this reputation as a kind of a sign of degeneration. You're an awful people, and it's explained by syphilis.
Yes.
And then Hitler tagged on to something that was very much 19th century thinking of certain groups are degenerate. And this was Jews, it was homosexuals, it was criminals, it was gypsies. And the problem with degenerate races is, this is all in Central Europe, of course, is they're going to breed with us and they'll breed us, people of pure blood, out. So Hitler latches onto that, and he becomes obsessed with the idea that Jews give, on top of everything, they give syphilis. But he wasn't alone, because a lot of the medical thinking believed that syphilis was congenital, not that it was transmitted. And why is syphilis such a peculiar illness, such a terrible illness? Because it's the only one of the very few that's transmitted across the uterus. So you could have, and this was very much a story in, let's say, the 17th, 18th century. You have a young man in the country. He goes to the city, as they do, to work. There's no women there, so he goes to prostitutes. He picks up syphilis, and he thinks, oh, I've got a rash. Rash goes away, goes home, marries. And then it gets interesting, because he gives his wife syphilis. And when she has kids, they're either stillborn or what do you call it? Congenital.
Yes. Yeah.
And everybody points at the wives. And in fact, it goes back so far that they burnt some of them because they said, you're a witch.
Yeah. Yeah.
So you can see how Hitler latches onto this idea.
So we've had this sort of, I guess that's a pandemic of syphilis. It's we don't hear about it much, I think, at least not in Australian health circles. But I'm sure it's there if you attend STD clinics and so forth. But that's sort of, I suppose, something we can manage. Well, take us back to some of the early pandemics, let's say from the Black Plague, the scourges, and there have been several Black Plagues. But do you want to start with that and just come forward through history?
Sure. But can I go even further back?
Yes, further back.
The question of infectious diseases, meaning and in epidemics and pandemics, is an intrinsic feature of human civilization. Now, if you look at hunter-gatherers, they are free and easy. They carry nothing with them. They never stay in one place.
Yes.
About, what's the figure, 15, 12,000 years ago, we settle down.
Yes.
And that's when civilization starts, structured civilization, societies,
revolution. Yeah.
all of that sort of thing. And we grow things. Problem is, we don't move. We live with our animals. We don't look after our feces and our urine. And it's a breeding ground for mutation of animal infections.
Yeah.
The animals usually rove around, so they don't bother anybody. But now they're penned in one place. And of course, they mutate because, hey, we've got this new source, these wonderful pet humans. So that's where it starts. And you see a lot of infections go back to them. This is the classic example. Okay, now you migrate on to, let's say, 2,000 odd years ago. And remember, if you were raised properly and you read your Bible, what was the scourge? The scourge was leprosy. Now, leprosy was massively over idea of people wandering around Palestine in the time of Jesus, throwing off limbs and arms. That's a dramatic overstatement. And the other thing is, it's quite hard to get leprosy. It's not like COVID. It doesn't leap from one to another. So we now know that what was often thought to be leprosy could have been all sorts of things. It could have been psoriasis.
Yeah.
It could have been syphilis.
Yeah.
Okay.
Yeah.
Now we move to Europe, Middle Ages, and what are you getting? You're getting urbanization, you're getting industrialization, you're getting cities and towns. Everybody's on top of each other. And who comes into the picture? Our friend the rat, which has got far more ability to survive than we ever have. Probably its pal the cockroach will match it. And this is where the plague starts. Now, this is the ultimate killer. And if you look at one of the worst plagues, the one everybody knows is about of the population. Now think of that. Think of any war you can mention besides maybe the 100 Years' War, where 30% of the population got wiped out. That's how drastic it was. So it led to huge political changes. Oddly, and of course, it also demonstrated something we still see. The plague is on there. People are dying like flies. You've got to blame somebody. So they often blame Jews. Why do they blame Jews? Well, they forced Jews to live apart. And if they were living apart, they were less likely to pick up the infections. They think, oh, you're better than us. It's your fault.
Yes.
So this is a very important aspect of epidemics, how people react, society reacts and looks for victims. But the interesting part about the plague, the big one.
Which year was that, Rob?
Somewhere around the 14th century.
Yes. Yeah.
That's as close as I can tell you off my head.
Yes.
Was because it wiped out so many people, it actually led to some improvements in economy. Why? Well, there were less people to compete for fewer resources.
Yes.
So that's how the plague started and had such an effect on geography, politics, society.
I did read that it was in some ways the mother of invention because there were less people to till the ground. So we had to start thinking about designing implements to take the position of those workers. A different type of intelligence had to develop to fill the gaps where there would have been people just doing those jobs previously. So it did change society significantly. But it's interesting, as you say, that social kind of the blaming factor, there has to be someone that's blamed, particularly when people are ignorant.
Exactly. And classically, can I mention how syphilis changed the story? Now, syphilis starts when Columbus returns from his first voyage and he lands at Naples. Now, in those days, you didn't have your own people, you had mercenaries. Now, that's where he's sailors.
Yes.
And there's a war going on between France and some Italian guy. So the war finishes and the mercenaries get picked up by both sides and they work their way back through Europe. And they carry syphilis with them. And that was even worse than the plague and leprosy combined. This is really your limbs do fall off. Grotesque ulcers, facial rotting, and that. And so it spreads through Europe. But then you see something very interesting. Syphilis needs a living host. Because if everybody dies on the spot, who are you going to go to? So over the next few centuries, syphilis mutates to become a chronic, milder illness like the one we know. And that is you get your primary and secondary infection, and then it seems to go away. And 20 years later, you've got the heart problems, you've got eye problems, you've got brain problems.
Delusions of grandeur. Yeah.
Yeah.
Yeah. Let's take us forward through those two epidemics to Spanish flu.
Well, that's very interesting. Firstly, it's very unfair on poor Spanish.
To call it Spanish, yes.
Because, in fact,
should be American flu.
Yeah, Spain hardly had any, and they just picked on it. It was one or two cases. So you know the story, it's correct. You've got First World War, you've got huge numbers of young men being put into military camps to do basic training in America. And then they put in a ship, which of course is a walking petri dish, and they sent over to France. And that's where the first outbursts come. Now, I'm not 100% expert, but there seems to have been successive waves. And the second wave was far more lethal
than
the first wave. And that was the one that spread around the world like wildfire. Now, the interesting thing, the statistics are just horrifying. 8% of the second wave die. And who are they? They are babies, young children, and elderly people. Now, this is pretty horrific stuff. And the figure, and remember, there's been huge amounts of work on this, is that 50 to 100 million people died. Now, this is not just a casual figure. Every reliable writer on the Great Flu epidemic quotes that and says, no, it could be minimum 50, maximum 100. You know, you'd say, all right, maybe 60, maybe 70 million, up to that. It wiped out huge numbers of people. And the interesting part, and this is where we get on to what we were talking earlier, beneath it, there was another epidemic.
Yes.
And this was encephalitis lethargica. And the problem was it starts pretty much in the same area. In late 1916, on the Western Front, so you got the French and the Allies on the one side, you got the Germans and the Austrians on the other, glaring at each other, and suddenly this strange illness comes. And that's the interesting part. Nobody knew what had seen an illness like this. Its victims get very tired, sleepy. They fall asleep. They're lethargic. They can't do anything. And of course, they're extremely sick. And if they recover from that, they've got chronic complications. So what do they think? The first thing they think is this is gassing, because of course, chemical gases were being used there. No, they exclude that. Then they think we've got some soldiers here from Mauritania or somewhere in West Africa. It's African sleeping sickness.
Yeah.
Well, it's not. It's totally different illness. So they're sitting there scratching their heads, and the first guy to sum it up was a psychiatrist called Constantine von Economo, who was seeing these people in his ward. And he calls it encephalitis lethargica, and he is credited with being the first one to recognize it. So for the next 10 years, he was the world authority. And a huge amount of literature comes out. But the interesting part about encephalitis lethargica, now you look at different statistics. Firstly, the figure is that it kills, let me get it right, 500,000 people around the world, including Australia, by the way, and we can actually track. It started in Tasmania, went to Sydney, and then to Brisbane, and from there. So if you get encephalitis lethargica, 40% of people die in the first episode, in the acute episode.
So more than from Spanish flu, more from...
Oh, much more, that was 8%, but much bigger numbers. So the problem is, if you get Spanish flu and you survive, you're fine. There were no neurological problems. With encephalitis lethargica, if you survive, your problems really start. you get Parkinson's, you get chronic sleepiness, you get a range of neurological and psychiatric problems. And here's where Hitler comes in. Children and young people get these drastic personality changes. They become instant psychopaths. So, look, without going into the whole story of the school of thought to which I belong, there's a very good case. Hitler was in the right place and that he got it, and this changed his personality.
Yeah, that's interesting. It's fascinating. And then that condition just as mysteriously vanished. We haven't seen that again. Is that right?
Correct.
Yeah.
By 1925, it seemed to disappear. Now, if you look at the literature, every decade you'll get a few cases popping up here and there, and is this a case or is it some other disorder? And that goes right through till the present. So it disappears. And the other thing, no one has ever decided on the cause.
We just missed a little bit of that transmission there. So
Yeah.
no one had decided the cause. What sort of working hypotheses?
Well, the current one it's either a reaction to influenza.
Yes. Yeah.
Or
like a post-viral.
it's something to do with streptococcus, because
right.
strep infections have antibodies which like to hit the basal ganglia, and basal ganglia causes Parkinson's. But there's no agreement.
Yes. So
and it's a lovely argument to put them all together and see how they fight about it.
It's very interesting. And so Parkinson's is another sequela of that.
Yes.
Some people.
Now, the classic movie that's been made is...
Sorry, Rob, can you hear me there?
Yeah.
We've just lost a bit of transmission there. What was the classic movie? It's just the internet's got
Awakenings with Robert Williams, and based on the actual cases of Oliver Sacks, the neurologist.
Yes.
Was treating these late Parkinsonian cases from EL when they started getting Parkinsonian medication.
It's fascinating, isn't it? Pushing forward, we've had, bird flu, swine flu. Of course, we've had a very big pandemic that's affected the whole world with COVID. We're all very familiar with what COVID has looked like. We've had some interesting reactions. How would you approach COVID, like from the perspective of a psychiatrist, and the way we all respond to that? Do you have any comments about how humanity behaved in relation to this pandemic?
Well, the first thing that you see is, of course, denial. And denial is often by people who have a vested interest in there not being such an illness. Well, in a social sense, and again, we go to this postmodern internet age, it's people who are, you might say, anti-scientific, alternative views of illness, and of course are strongly anti-vaccinations.
Yes.
So they've got a very strong vested interest in denying that, and we saw that all over the place with this illness. Now, the other thing to forget that's forgotten is, of course, there are cases of, I call them neuro-COVID. In other words, where people get post-infectious neurological symptoms, and that clearly overlaps into a psychiatric problem. And that is still being checked out. But there is a very good analogy. The flu epidemic in England in 1951 is the only flu epidemic that had neurological consequences. And these people were chronically tired, they were depressed, they were flat out. And what's interesting is how they treated them. They treated them with amphetamines, and they had very few problems with addictions. And people said, wow, I can survive, I can cope. So I've been saying to people, I'm waiting for somebody to do an amphetamine trial on post-COVID lethargy.
Yeah, that's interesting. It's a bit like the ADHD sort of treatments, but it's using modafinil, I suppose, would be another consideration.
Correct.
Yeah, that's very interesting. Robert, I'm fascinated with your depth of knowledge in relation to these, these pandemics, and they are fascinating. I'm sure, there's a mixture of sociology, microbiology, and behavioural kind of medicine in relation to what you're writing about. This is part of your book. What else is in your book that is currently published, and people might want to, I'll put this in our show notes, people might want to now purchase, having listened to you, The King Who Strangled His Psychiatrist and Other Dark Tales. What's the other gist to that? What are the other parts of that?
Look, this is a kind of a book where I say, look, this is not scientific. This is just my particular choice of interesting ways in which people get ill, or sometimes say they're ill when they're not.
Yes,
So I range over all sorts of things. I mean, for example, I talk about Harold Lassiter. You know, the guy who said there was gold and there wasn't, as a
yes,
case of chronic lying.
yes.
Can you hear me now? Was it
Yeah,
all?
I don't know what's unstable. That's all right. We'll edit those little bits out. But we were talking about Lassiter and who
Yes.
lied about gold. Yeah,
As
Lassiter's
a,
gold. Yes.
what happens when people tell big lies and they get entrapped in them? And then the next chapter, pretty soon, was, of course, Melbourne's famous lady, Belle Gibson,
Ah,
one who said she had cancer but
oh
made
yes,
millions out of it but didn't. And
yes.
then I look at, for example, problems of political leaders, like nobody knows that Richard Nixon once had a psychotherapist who said everything about, which he shouldn't have done, about what his patient was like, about people who are assassins and what was wrong with them. And a condition uniquely Australian almost in Groote Island, where the Aboriginals people there have the world's highest incident of something called Machado-Joseph disease, a terrible neurological illness. And nobody knew where the hell this came from until they found out it was brought from Portugal to the Malaccas. And the Malaccans came to do, what did they get? Sea cucumbers.
Oh,
And of course, there was the usual exchange of body fluids. But because they were stuck on an island, they interbred. So now they're stuck with this horrible disease. At least we can do a few more things now. So those are the things I jump around.
oh, well, that'll be a fascinating read, Rob. Is it available on Amazon, or do we have it?
I'm busy finishing the draft.
Oh,
So
I see. Quite
get it
available.
out.
Yes. Okay.
It's
Thin
on its
press.
way.
Okay.
Yeah.
Well, now, Rob, tell us. I know you've got another appointment you have to get to fairly soon, but just a very quick précis. You've written some other books on medical serial killers. Give us some highlights of some other books that you've written because people will be interested in this.
Look, the first book was called Medical Murder, Tales of Doctors Who Kill. I'll come back to that. The second one was called The Exceptional Brain, and that's very much along the lines of The King Who Strangled, looking at individuals and stories throughout history. Now, medical serial killing uh, got me interested when Harold Shipman
Yes.
became Britain's worst serial killer. And what interested me was I thought, listen, every psychiatrist in town will be writing about this. And well, nobody was. So it was just too good a chance. And then I found out they were all saying, oh, look, this is a freak event. Well, it wasn't a freak event. When Shipman was busy decking his poor little old ladies, a guy called Michael Swango was wandering around as an aspirant neurosurgeon, and they thought he was good at neurosurgery. And he was injecting people in hospitals till he killed 60. So it really opened the whole field up to me. And that's how my book came. But since I've written the book, I'm very glad to say doctors have gone down one step because the fastest growing form of serial killing in the world is now nurses and nurse aides killing elderly patients in nursing homes. For every, Ivan Milat type serial killer, or street serial killer, 5 to 10 elderly people or kids are killed by nurses. And of course, we all know the story of Lucy Letby in Britain as the most recent example.
Well, what's their motivation there? Are they taking pity on the elderly? Do you think the elderly are asking them that they don't want to live any longer? Or is there some other vicarious pleasure that they get maybe in controlling someone's life at the very end of it?
You've summed it up, definitely the second part. Look, the interesting thing is whenever they get caught, the first thing they use as a defense is,
Yeah.
oh, I was making it easy, that I was euthanizing them. Not in the slightest. It seems to be, firstly, we've got, this gulag of nursing homes and retirement places. You get anybody, they're all understaffed, they're all overworked, there's very little supervision, all sorts of people drift in. And if you're running an old age home, you walk in the morning, oh, who died last night? This one, that one, that one, tick, tick, tick. Get the doctor who's annoyed, he just scribbles out the certificate. So it's very easy to do. Elderly people are easy to kill. You just put a pillow over their face, You cut off the oxygen tube, you inject them with something, and on it goes. They are disturbed personalities, they're unhappy in their home life, and they get sort of hooked on it. They often are abusing the patients, meaning they're rude to them, they treat them badly, and they steal. They steal their goods. And then this sort of builds up into, well, they just kill them. And of course, they can do it at night when nobody's around, and on it goes.
Gosh, it's a dangerous place.
Yeah.
It's a dangerous place, Robert. Um, Rob, thank you for writing about, these very, very interesting topics. Your current book is in press, so we can't buy it just yet. It's perhaps a bit early for me to ask this, but what will you be working on next? What's going to be your next project?
You mean after this?
Yes, yes,
Oh, gosh. I'm thinking of writing a sort of the kind of essays I've done, like the thing on pandemics,
yes,
uh, and putting them all together. I'm also very concerned about the current state of medicine and psychiatry.
yes.
And I'm sort of trying to do a kind of an overview of what I call the postmodern medical world, for which the basis is this. Doctors used to own medicine. We had patients and they had to do what we told them. Now we don't, if we've lost that power, now they are consumers, and consumers want perfect results, and we've got to do what they tell us. Of course, in the internet world, they come in and tell you what's wrong and what they want from you. So that's the kind of overriding idea that I'm trying to look at.
I think that would be fascinating, Reid. I have to agree with you there. I sometimes feel that patients in some circumstances have become a commodity, and
Yeah,
the commercialisation of medicine is not the reason we went into medicine. But you can see, and I'm a proceduralist, so I'm probably partly guilty here too. But there's a commercialisation of it, which is not. It's not really healthy for our community. And you're quite right. We've lost that agency that we used to have, I think, in terms of our management. And you see that through hospital structures. And here in New South Wales, there's been a major concern with psychiatric services provided there. So it's
absolutely.
going to be interesting to see the future, how that evolves. Rob,
Mhm.
for a young doctor, do you have any good advice? Give us one, pithy bit of advice if you can for a young doctor in entering the profession.
Well, I have this problem with medical students. I say, if you want to know and plan for your future, read the good novels about medicine, because that'll get you thinking about it. That's the first point. The second point is, don't ever go into medical training and say, I'm going to be a dermatologist or I'm going to be a radiologist. You will be very surprised at the way you turn out, and just keep an open mind for that.
Yes, that's sage advice, Rob. Well, look, Rob, thank you very much. Obviously, we're much better off for having a man of your calibre in the psychiatric field. I do thank you so much for being a guest today, Rob, and look forward to further communication, perhaps when you're in Melbourne. We really hope to catch up with you.
Thank you. Look, it's been a pleasure to talk. I'm sorry it's a bit rushed, but I will send you my dates and times, and hopefully we
We'll
can.
catch up and talk a lot more about this incredible subject. But thank you so much. Well, I would like to thank you for joining me in the conversation with Rob Kaplan today. I found this very interesting, and I would urge you to buy his books. Look him up on his website. They are incredibly well researched and beautifully written, and really are a great read. Well, during the podcast series, we will be covering a wide range of topics across many specialty interests. The discussions are not intended as specific medical advice for patients, but as general information only, and reflect the opinions of the guests interviewed. Requests for new topics to be reviewed and comments about the conversation you've listened to are welcomed and may be emailed to manager@geohealth.com.au.